Hello, it's Wanda of Wanda Budgets and Beyond here with a quick video regarding medical debt, the burden of medical debt in the United States. I printed out an article and I just wanted to read you some of the information that is on here regarding medical debt. And I am sure that if possibly not yourself, you know of family and friends that have medical debt, a lot of it, if they've shared with you that they have a lot of medical debt. And medical debt is a reason, maybe a large reason why some people go into bankruptcy, which is a whole nother topic. And some people will tell you some of the good parts of it and the bad parts of it, etc. I guess when you're discharging any type of debt in bankruptcy, not that I've ever done or anything, but the little bit that I know, of course, after that, you have to have a mindset shift, with regards to that, because you're going to find yourself getting back into debt, etc. But today, in this little brief video, I'm going to be talking about medical debt and reading some information that I got from online, of course. And this is from Health System Tracker, but most of the information comes from the census, from a particular part of the census, the SIPP, which is the Survey of Income and Program Participation. And it is something that is done by the um, by the U.S. government, by the census. Of course, our next census is going to be in 2030, and I am sure that is going to be interesting. And if you participate or not participate, just know that there's one coming up in 2030. And part of, or some of the reason, well, a reason that I've heard that it is a good thing for people to participate in the census is because it gets, in essence, the whole ball of wax is it gets tax dollars to your particular state, your city, et cetera, et cetera, et cetera. You know, the trickling down of money, et cetera. So you get to be counted in the numbers, and then they can, via proportion or portion, the different funds to the states, to the particular areas, et cetera, et cetera. But the 2030 census is coming up, of course, in 6 years. But the burden of medical debt in the United States, and we know this already, the first sentence that I am going to read, most people have some type of health insurance. If they have a job that offers health insurance, most people participate in that particular health insurance. However, most of the times it's probably not enough health insurance, and people are finding that they're having to come out of pocket for the remainder, etc. And then the out of pocket cost gets to be exorbitant if there are extenuating circumstances regarding a particular health issue, etc. If it's ongoing, chronic, if you've been in a serious accident or something like that, and there's ongoing care for many, many years after, that is medical expenses that are going to continue also too. And if you have some type of work-related accident, and if your company offers, or they're supposed to have workman's comp, you're going to have to go through that bureaucracy to get the workman compensation funds. But then your care is going to go on and on and on beyond after the time, after the fact that you get the money, and then you may be spending the money that you get from them for the ongoing medical care. And then when that runs out, you're back to where you're at. But nonetheless, the report goes on to say, despite over 90% of the U.S. population having some form of health insurance, medical debt remains a persistent problem. Yes, it does. And if you have some type of chronic illness, something that is ongoing, and it's going to be ongoing until the end of your days, then, and you have insurance, and at some point, these insurance company get a little nasty, and then they're going to cap you out at some particular point to where they can't sustain paying. If your costs are 10 or 12K, per month or something like that, just an example, then at some point, risk reward is not worth it to the health insurance company. And sadly, it is set up in that particular way. And these high deductibles, like this article was saying, and like some of you already know, you have to pay so much out of pocket before the actual insurance that you are paying also into kicks in. So that's a whole nother thing. High deductibles and other forms of cost sharing can contribute to individuals receiving medical bills that they are unable to pay despite being insured. Yes, this thing goes on to say that a KFF Poland, and that might be Kaiser Family Foundation, I don't know, it doesn't say what it is, um, shows that people with medical debt report cutting spending on food, clothing, and other household items, spending down their savings to pay for medical bills, borrowing from family and friends, etc., to pay down their medical bills because they know that they're going to need to continue to go back to the doctor, I'm thinking, and they don't want to go to the doctor and their bill is going up, and then they are saying that they cannot have, that the doctor won't provide them with care. You can go to an emergency room, but if you have cancer or something, going to the emergency room is not going to, in my brain, solve your problem because it is something that is ongoing and you need radiation treatment, and the emergency room does not provide that. So people are doing all that they can to try to stay above water with their healthcare provider or providers so that they can continue to get the care. But they're having to do other things in order so that they can, get the money for that, cutting back on things. What else? There's a lot of things in here. Uh, so the total that this particular SIPP survey said that folks owe was total medical US debt was 220 billion. I'm reading some notes over here. 14 million of these, 14 million folks, 6% of adults owe over $1,000 in medical debt, and 3 million owe more than $10,000 in medical debt. That is a lot. That is a lot. And I go on and I keep reading. Da 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 da. Let me go over here. Okay. While medical debt occurs across demographic groups, oopsie, people with disabilities are in worse health. Lower income people and underinsured people are more likely to have medical debt. That makes sense. If you're uninsured, you just don't have insurance and you need care, you're going to go get the care. You're going to have that debt. Lower income, you can't afford to even possibly pay for the insurance that your job provides, and of course you're not buying it on the public market or the private market either. People with disabilities, that goes to it is what it is. Hopefully the folks with disabilities can get on some type of state assistance, etc., to help in that particular case. um, but yeah, but the report goes on to say middle-aged adults and Black people are more likely to have medical debt. Even though all demographics have it, middle-aged adults and Black people are more likely to have medical debt. Yes, and the report goes on to say that medical debt decreases when people get older. Getting older meaning they get onto Medicare or Medicare, yeah, get onto Medicare, and then that's where people see that the cost of medical health, your medical health goes down. Well, the insurance of it, part of it goes down, etc. But okay, that's iffy. Even though you're getting Medicare, you still have to pay for some type of supplemental insurance. Just the fact of having to pay for supplemental insurance is tricky, and it can be an additional cost that people don't want or didn't think that they would have to have when they reach Medicare age. But that's been going on for some time, and here we are. Here we are. Black Americans are far more likely than people of other racial and ethnic groups to report having medical debt. This analysis shows that 13% of Black Americans report having medical debt compared to 8% of white and 3% of Asian Americans. Very interesting. Women are also more likely to report having medical debt, 9%, than men. Men are at 7% on average. Some of this difference is likely related to childbirth expenses and lower average income among women than men. Low and middle income adults and those without health insurance are more likely to have medical debt. Yeah. The report goes on to say some things that we know. But with regards to the people that share my reflection, and if you happen to be a woman, yes, that we are right there. So we always have to be mindful of where it is that we are putting our money, our health, wherever we are with it. If our health is, if we're in good health, bad health, indifferent, in the middle, etc., we always want to be mindful with regards to our health. Everything is money. Uh, everything has a cost now and in the future. Everything has a cost. So we definitely want to make sure that we are putting our money in the places where it needs to go. If we need to beef up getting more health insurance for ourselves and our children, etc., and we can do that, then do that. If we need to do some other things, like the story was saying, and like we already know, you're cutting back on stuff so that you can pay for your health insurance or your medical costs when you actually do go to the doctor, etc., then we need to change some things so that we can be able to put more towards, in this particular case, it's the medical thing, the medical insurance, or beef up our medical insurance, etc. This, that, and the other. We want to make sure that we are doing that. No one is going to save us, as I say and mention all the time. No one is going to save us. So we need to do the things that we need to do. And when we learn things, and I get it, it takes, all of this stuff takes time. Getting your budget together, getting your finances together, all of this stuff, it can take time. And of course, learning the information also into, and then of course applying it, because in the end, it is going to be you and your spouse, or just you and your children, etc., that is going to have to bear the brunt of all of this. So yeah, definitely. I know I need to get my stuff in one socket, trying to over here. It goes on to, and in a lot of this report, it states some of the things that are obvious. Medical debt can happen to almost anyone in the United States, of course, but this debt is most pronounced among people who are already struggling with poor health, financial insecurity, or both. Like I just mentioned, poor health. I need to get mine on track. It's not, well, anyway, I need to get mine on track. Let's not, let's not quabble, Wanda. Get with it. Poor health, financial insecurity, or both. So if you have a lot of stuff going on, if you have a lot of debt and in a whole lot of places, etc., like a lot of consumer debt, you got the student loan debt, you got to live, eat, you got to have some place to live, you got children, all that is associated with that. You got all of that going on, and then you're not doing a budget and a whole lot of things to try to get yourself back into, get yourself, get your head above ground with your debt, and or get out of debt, working towards getting out of debt, then it's going to be problematic. Then you may find yourself with a lot of medical debt and a whole lot of other stuff. But this report was talking about medical debt, just a whole lot of things. And we see that, as with a lot of things, it has a cascading effect. So if you are trying to get out of debt or reduce your debt, and then at some point get out of debt, and out of debt would include all the things except for your mortgage. If you do the Dave Ramsey thing, which I don't, but I do listen to and follow some of the tenants and tweak here, getting out of all of your debt except for your mortgage, and you have a plan, then that is a good thing. You're budgeting, you're living below your means as best you can. You're cutting back this and the other over a period of time, and the mindset shift, etc. Then that is going to be a good thing. Then you can put your money to the places and the areas where it is most important. You're going to be alive for a long time, hopefully. Then medical is going to be one thing, and then medical for your children. And then it's possible, if your children are past 18 and they may not be able to afford medical insurance for themselves, and you as a parent don't want to have them out there just like that without any type of medical insurance, and you take that on, then you're going to need the money for that also too. So yeah, I found that this was pretty interesting. This was a pretty interesting report. The Consumer the Consumer Financial Protection Bureau, CFPB, estimates that 88 billion in medical debt is reflected on Americans' credit reports. So of course, if you owe a doctor or a hospital or urgent care type facility where you went and you got some medical service, and you don't pay, eventually it's going to end up on your credit report. And then, of course, we see the trickle down. It's on your credit report. You're trying to apply to get a house or some other credit card or something that you and or your child or children need. Is problematic because you have that and maybe other things on your credit report. But per this, per the Consumer Financial Protection Bureau, 80% of medical debt does appear on a person's credit report. So that's another thing you have to add to something that you need to go and take a look at, etc. Your credit report, especially if you are saving to buy something. And sometimes, people forget something may have happened to you when you were 18 and now you're 28, 29, 30 and you want to buy a home. You've long since forgotten that something happened to you at 18 and you have this medical debt out there that is now in collections and it has gone to your credit report and now you're trying to buy a home and here you are, you have this on there, you had totally forgotten about it. Hopefully it's an easy fix. You pay it off or you negotiate a particular amount and say, hey, if I pay you this, you take it off, the debt will be over and done with, and make sure you get everything in writing if you do that, just as an aside. And here you are, you got that. If you get it cleared up, great, but then it may hold up your getting the thing until you get it cleared up. So once again, another task to add to your list of things that you need to do. And it goes on to say, with regards to that, in addition to the 88 billion of medical debt being on, getting to a person's credit report, though they acknowledge that the total amount of medical debt is likely higher because not all medical debt is visible to consumer reporting companies, and those data only reflect debt among people with credit reports, not all adults. Okay. Medical debt can also be masked as other forms of payment. For example, when people pay for a medical expense on a credit card or fall behind on other payments to keep up with medical bills. So yes. But yeah, just a little something about the state of U.S. medical debt in the U.S. per the SIPP Survey of Income and Program Participation, which is a part, I guess it was a part of the 2020 census. And this report is from February 12th this year by Peterson KFF, which I think is Kaiser Family Foundation, Health System Tracker. Shamik Rashid, Matthew Ray, Gary Claxton, Rutika Amin, and Cynthia Cox were contributing reporters to this particular report. But yeah, medical debt in the U.S., medical debt, even though a lot of us have insurance, it still is not enough to cover all medical costs that we have or get, etc. So yeah, another something to think about, folks. Another something to think about. Thanks so much for being here. I do appreciate it. Take care and have a great rest of your day. What is that that's floating in here? Oh my God. Bye-bye, folks. Bye-bye. That was crazy.